Levy. I'm a physician scientist at Boston Children's Hospital. And today I'm going to encourage us, because we are, after all, reflecting on our great nation's first 250 years and imagining the next 250. So in that context, I'm going to encourage us to remember the future. And in doing so, to build on an American pediatric tradition. And as we think about the vulnerable infant, we can start with the biblical tale of Yocheved, who put her baby Moses on the Nile River to protect him from the Pharaoh's decree. The notion of a parent would do anything to protect their loved infant, and the sense that the infant is not just little, but they're really different in all sorts of ways that were not understood at a basic level at that time, but were intuitively understood. Of course, this notion of change through age was reflected on by the Greek philosopher Heraclitus of Ephesus, who said that the only constant thing in life is change. From the day we're born to the day we die, our body is changing, and the immune system is no exception. And so there's the sense that the young newborn is distinct and is about to change very rapidly. But remarkably, it took a very long time in the history of medicine and care to have a distinct specialty that focused on infants and children. And here, in these United States, it was Dr. Jacobi, an immigrant from Germany, working in New York City, who is generally considered the father of modern pediatrics, the concept that pediatrics should be its own medical specialty. And he was concerned about environmental causes of disease in children, which is why he focused on pasteurization, sanitation, and high-quality housing. There were multiple female pediatricians, many of them, who were absolutely critical to the history of pediatrics. Sarah Baker worked in New York City, again with immigrant communities, and the concept of, rather than having high childhood mortality, can we think of ways to prevent disease? It was a very basic but crucial concept. And then Lila Denmark, a remarkable pediatrician who practiced out of a farmhouse in Georgia, actively practiced in pediatrics till the age of 103. A pediatric legend, right? And she was a co-developer of the pertussis vaccine, the diptet vaccine against whooping cough, and also one of the first Americans to point out the danger of secondhand smoke in children. So the point is, as these pediatricians provided care, they realized that we as Americans, through all of our diversity of race, ethnicity, socioeconomics, religion, political point of view, there's one thing we can agree on. We care about our infants, and we want them to grow healthy and grow well. As director of a precision vaccines program that applies precision medicine principles to vaccine discovery and development, we are fortunate to be funded by the US NIH and by other sponsors to study children, not just in the US, but all over the world, as their immune system develops, to develop cohorts of infants that are followed from birth as they age. And clinical data is captured, biosamples are captured, and we submit these biosamples for very sophisticated assays, systems biology assays, that can measure from a tiny drop of infant blood all the cells and molecules in a sample. And we're doing this not just because it's high-powered, prestigious science, but we want to correlate it with a clinical outcome that matters. Does the child grow healthy? Or is this a child that has frequent respiratory infection? Does the child grow healthy? Or is this a child who develops wheezing and asthma? Is the vaccine response robust? Or is it a weak vaccine response? Because in many cases, we don't know the reasons for these clinical phenotypes. But as we travel the world, we notice something, which is not just an American tradition, of course, to care for our infants. It's an international imperative. And wherever we go, our team has visited on the ground in the Gambia and West Africa. And we have a project in Rome, in Italy. And we've been to Australia, and members of the team have been to Papua New Guinea. Wherever we go, the pediatric research staff has an incredible morale, incredible esprit de corps, because they believe in the mission of remembering the future. And so one of our most sophisticated projects is called Immune Development in Early Life, or IDEAL, funded by the US NIH. And we note by following these cohorts as they age and obtaining these biosamples and measuring the cells and molecules and correlating that with outcomes like common outcomes like asthma and wheezing and allergy. Did you know that 1 in 3 US children have atopy, which is like eczema, allergies, and asthma? 1 in 3. We could be doing better. So we want to not just understand the cells and molecules that correlate with that, but discover ways to redirect molecular and cellular development away from disease and towards health. And we do that in part by modeling immune responses outside the body and testing whether we can build vaccines that are even safer, even more effective with fewer doses, and not only protect against infection, but reduce common chronic diseases. So my call to action to you today is to remember the future, that's our children, to advocate and support for national and international pediatric research. There's tremendous value in comparing these infants across the globe that are exposed to different environmental situations, that have somewhat different vaccine schedules, so we learn from that. And to ask your elected representatives how they are supporting advances in pediatric health. And to separate politics from science, these don't always mix very well. And to follow us at PREC Vaccines for those of you who are on X. Thank you very much.